patch and increased to 0.05. Is it hard for me, my body to adjust? Hello, YouTube. Thanks for joining us for Tune In Tuesdays. We are also live on TikTok. So some of the questions I'm answering may be from there. So Remy's asking, is it hard to increase from 0.0375 to 0.05? So in the scope of doses, 0.05 is about half the dose. So in general, it takes your body about 90 days to assess a dosage adjustment, but most of our patients do pretty good. Some people are a little bit sensitive to that amount of increase, but it's not really thought to be a big increase. TinyCat0703, why do I have to pay $1,500 just to walk in your door? Actually, that's not actually accurate. We are not contracted with insurance, but we have nurse practitioners and PAs that are ready to see you, and they have what we call fee for service, which means you pay for your visit. And don't ask me what the price is. It's somewhere around $200 to $250, but the prices are all on our website in full transparency. So if you're wanting to know what the prices are, you can just head to Form Health Akron. But that you can certainly see one of the other providers for much less. User 2065428, can estrogen deficiency truly affect your joint? How to reverse the damage? Great question. In my experience, low estrogen contributes to joint aches. Estrogen in the proper amount is anti-inflammatory. So as you have the lack of it, you lose the anti-inflammatory natural benefit that your body does. So people seem to have inflammation. And that's one of the things that's so cool to take. My sister didn't have hot flashes. She didn't have any issues. And she said when she started hormone replacement after a thorough risk benefits discussion, she said, you know what? I'm not having any joint pain anymore. That was her number one symptom. Eliza Arlene, I think I have HS, and my PC response to me was that women don't have to shave. Well, I think it's much more for those of you that don't know what HS is, hidradenitis suppurativa. It's usually related to insulin excess and sometimes androgen excess, coexists a lot with PCOS. In my patient population, I do have some patients that once we balance their estrogen and progesterone, with or without taking progesterone, they actually have an improvement in that. Thank you for the gifts. I still really got to figure out what that means, but thank you for those of you that are giving me gifts. For those of you on YouTube who weren't on, the sound is low. I wonder why. I have it all the way turned up, but thanks for letting me know, Purple Heart. So those of you that are turning in late, we have some new resources for you. The link is in the bio and YouTube. Make sure you're hitting subscribe. We have a weekly newsletter, and we've got the links to our free download about everything you need to know about testing in perimenopause. Also, the link to our free course that was just assembled. How do I lose belly fat? Gosh, belly fat is a hard thing, but I will tell you there's a couple reasons you could suddenly see you have belly fat. One is perimenopause, usually menopause, because we have seen that estrogen does increase your amount of belly fat, specifically in the abdomen. And also it's related to insulin. First, we would want to know, is it visceral fat, meaning is it on top of the organs or is it on top of your abdomen? So we do have a body composition machine in our office so we can see what your risk of your visceral fat is, which is tied to cardiometabolic risk. One of the things you can do, is do some overnight fasting and intermittent fasting. We call it time-restricted feeding. Sometimes when you go 12 to 14 hours, a couple times a week, that could be the issue. Get your insulin and A1C and glucose measured. Think about a low glycemic diet. Oh, there's a couple people that can't hear me, but I do see, Nicole, thank you that you can hear me. Okay, thank you. Okay. Eliza Arlene, I have POI and thought my hormones were just adjusting. I'm confused. Does shaving cause it? Well, there's there are a lot of things that can contribute to HS, Eliza. So it could also be your microbiome. So if you have a provider that's able to do a stool testing or test your microbiome in any way, that can change with POI. For those of you that don't know what POI is, it's premature menopause. So that could be part of the issue with you. Carla Sarah, I'm 40. I'm a very healthy person. I work out, healthy diet. How old until I can get pregnant? Great question. And I seem like I'm seeing more and more fertility patients in my office. There's a couple of things that we do in our office. One is called an anti-Müllerian hormone. We would check your FSH and your estradiol on the third day of your cycle. It gives us an approximate measurement of your what we call ovarian reserve. So just like your quality of your eggs. Now, a fertility specialist would couple that with an antral follicle count. So it really depends. I have had patients that have gotten pregnant in their mid 40s. My own sister, I had struggles with infertility. She got pregnant at 40 and 42, no problem. So it just depends, Carla. Pretty girl ask, my practice that I see patients with is called Forum Health, and Forum Health Akron is in Akron, Ohio. We're about half an hour south of Cleveland. So we have to see people in the state of Ohio. It's funny because I was just teaching doctors. One of the things I am involved in doing is teaching for one organization is the American Academy of Anti-Aging, Regenerative, and Functional Medicine. And we had a program this weekend that I taught, and we were trying to explain to the doctors there that the rules are state specific. In Ohio, we have to see you first. Okay, triple heart. If I'm going to start estrogen for the first time in perimenopause with adenomyosis, what blood work do I have to do? Well, first of all, let me say that a lot of people start progesterone well before they start estrogen. And it's not common to start estrogen first, especially if you're at adenomyosis. That is a condition of estrogen dominance. So if you're still cycling normally, a lot of times you don't need the estrogen right away. Sometimes you do. It really depends on your estrogen level. So I'd really want to make sure that your doctor was checking your hormones maybe on day 3, but also on day 21 to assess your progesterone. Nicole, I really lack motivation and energy on a daily basis. Any suggestion? Well, there's a funny thing about energy. If someone tells me they're tired all day long, they never feel good, I think thyroid. So I want to do a full thyroid panel, TSH, free T3, free T4, and reverse T3. If someone tells me they feel good in the morning and then they have a slump, and then they feel better after they eat lunch, and they have a slump in the afternoon, 4 p.m., and then they feel better, that makes me think it's your cortisol. Low androgens can also make you feel tired, low DHEA, low testosterone. So there's a bunch of things that could be. And when a patient comes into me with those questions, we do a full hormone assessment. HB Jacks, reactions to patch adhesive and don't like daily gels. Oh, I wonder what you don't like about the gels. We do use the estrogen gels, and we also use an estrogen bias, which is a combination of estradiol and estriol. I do not use estrogen injections, mostly because we're trying to do mimic what the body naturally does. And the body doesn't give you one burst of estrogen once a month. So that's why we don't. Elena K started 25 mils of progesterone cream last night. Woke up so tired of the cramps. Was told to lower the dose. Is this right? That's a higher dose than I start my patients on. I usually start my patients on 10 to 15 milligrams. But again, that depends on a lot of things: your age, your body weight, your estrogen level, your progesterone level. So it could be that it was too high of a dose for you. It's hard to say. Pretty girl, I'm 42, want to get pregnant. Should I request a hormone panel to start the process? I have a regular period. Good news that you have a regular period. That could mean that you have the building blocks for pregnancy. So I would definitely want to get principally day 3 hormones on you, but also day 21. Yes, I would definitely want to know, pretty girl-esque, because it's important for you to know, like, am I going to have a problem? Should I go straight to infertility specialist? I mean, the chance of spontaneous pregnancy does decrease after the age of 35 and certainly after 40. But I know lots of people that have gotten pregnant over 40. So yes. Triple heart, purple heart, which hormones should be checked before I start? All of them. I'm very symptomatic. Yes, all of them, specifically estradiol, estrone, FSH, LH, progesterone. As I mentioned, we have a free testing guide that we just put. So click the link in the bio if you're here on YouTube. The link is in there. And also click the link in the bio here in my link tree in TikTok. If it's hard for you to find the link in TikTok, the link tree, you can also head over to Instagram. You can sign up for our free newsletter. Hi, John. Great to see you tuning in. Hope you're doing well. And yes, I had a sign made. It's funny. I have had a sign made because that's what all the kids do for the weddings, and the neon sign. I'm like, this is super reasonable. It might have been made overseas, but I said, let's do one for Hormone Guru. So I put it up here in my office. HB, I meant the biweekly estrogen injections that are similar to patches. So injection and a patch are not the same. They are 2 different modes of giving you a hormone. The pharmacokinetics are different. It's still going to be up and down. Even if you do it closer, you're still going to get a burst of it, and you're going to get up and down, and it would be kind of hard to, but I'm sure some doctors do it. I don't have any experience doing IM injections for estrogen. There's so many other ways to give it, so we haven't really had to. Eliza, I'm not completely in menopause. POI stands for premature ovarian insufficiency. Yes, that is, I know what it stands for, Eliza. And so that's one of the things that we call POI or premature menopause. So I'm glad that you have some ovarian function. Stella, can you have an appointment via telehealth? So we have to follow Ohio's rules. Ohio's rules say that for us to initiate care, we have to have a face-to-face visit first. So we have to do that, and we can't establish care in telehealth. If you come to Ohio and see one of us, then you can follow up for a year after that via telehealth. User 93712, I keep getting vertigo around day 9 to 12 of my cycle. Any ideas? That's really interesting. Vertigo is typically associated with a drop in estrogen. Day 9 to 12, though it shouldn't be dropping, it should be increasing. So there is a chance, user 9371, that maybe it's the balance of your estrogen to progesterone. When we have patients that have really unusual complaints at a specific day of their cycle, we do something called a cycle map, which is a at-home test, which you test 11 times throughout your cycle. And usually it's like 8, 9, 10, 12, and so many times. So it's either urine or saliva. It is a functional test. It's a very comprehensive test. It is not cheap, but it gives us a lot of great information for people like you. Crystal, B421 on estradiol patch 0.0375 once a week and 100 milligrams of progesterone, had spotting after steroid shot for back pain. Yes, anytime you get a steroid orally or a shot, it can definitely affect a lot of things in your bodies, and it can make you have some spotting. So I wouldn't necessarily worry, and I would maybe write it out, but you could always check in with your GYN. Pamela West, what if your doctor will, test your blood vessels? I am 58 years old and perimenopausal. Will test? I think maybe you mean will not test your blood levels. Well, Pamela, unfortunately, we are not taught to check levels in our traditional testing. So your doctor may not be comfortable doing anything they're not trained to do. So what you could do, Pamela, is find a doctor that is involved in testing hormones. So I always refer people to the A4M website, www, the letter A, the number 4M, and you can go to a directory. You can put in your zip code and look who is experienced with BHRT. Crystal, your spotting stopped after about a week. Okay, so that's good news. Okay, triple purple heart. My estrogen was 99, but I still have all the symptoms of low estrogen. So that isn't a low estrogen level, but I don't know when in your cycle that was. Most people, the symptoms of low estrogen can also be from low progesterone. So I really want to check that before I did, and with a normal estrogen level. And again, I don't know when that is. Underactive thyroid and perimenopause. What can we do to find relief? Lubna, Canefa. Well, so thyroid, a lot of time has to do with gut. So think about an anti-inflammatory diet, minimizing gluten and dairy. You can read the autoimmune, the Hashimoto's protocol by Dr. Isabella Wentz. She has kind of a dietary thing. So I think that could be helpful for you as far as your thyroid and perimenopause. So as estrogen changes, thyroid is definitely involved. Some good thyroid support vitamins are selenium, 200 micrograms, zinc, and B vitamins are also good, and sometimes just a little bit of iodine. Purple heart, you don't have a period. So I wonder if you don't have a period because you don't have a uterus, or you have an IUD, or because you actually don't have a period. So that makes a little bit of a difference. Okay, hopefully we are up and running on YouTube. It looks like we have a few followers, so thank you guys for joining us, albeit late. So any questions, just type in the chat. So what we're really excited about is this new mini course that we have. And so we've compiled some videos, and don't laugh because some of them are really early. So I think I started making videos in 2017 on Facebook, and they're so stiff. I'm like, hello, my name is Dr. Scott. And so the information's good, but the video is terrible, but we have to probably reshoot some stuff. But it's been super busy teaching season. And as I mentioned, I'm studying to recertify my integrated medicine boards, which we have to take that test every 8 years. So we'll get around to reshooting some of those videos. So they're maybe a little bit more current. Maybe the hairstyle's not current, maybe the content. But that is something for a lot of the most common things that we are. If you haven't also signed up for our newsletter, we have a free newsletter that comes out every Tuesday. So get on our list for that and subscribe to us over on YouTube, because what we're trying to do is repurpose these lives. For those of you that can't catch them or maybe don't want to hang on right now, you can rewatch on YouTube as well. Okay, Leila Manaz, can I take progesterone only, no estrogen, and 55? Great question. Thank you for asking that. You can take progesterone without estrogen. And triple heart, for somebody with high estrogen and low progesterone, we would start progesterone first. So there isn't a problem taking progesterone without estrogen. Where I believe there a problem is taking the estrogen without the progesterone. So I know it's confusing. Crystal B421. We are not contracted with insurance. We were for a long time when I opened my practice, but unfortunately they were forcing us to see patients in 7 to 10 minutes, which is hardly long enough to go through a history. So anyone who wants to use their insurance can try to go to Cleveland Clinic Functional Medicine Center. We usually refer them there. Okay. Thank you to those who are joining. So as I mentioned, we have our free mini course. So check it out. There are links in YouTube, and you can catch the link in my link tree in my bio here. Kelly, after period migraines have been new for me. So that's interesting. Most people have migraines a couple different places in the cycle. More commonly, it's right before your period starts. That is from the drop in progesterone and estrogen. Sometimes people have them after the period as they get a little older, in their 40s and later 40s, because the estrogen isn't increasing as quickly as it should. Sometimes people have migraines in the middle of the cycle with ovulation because estrogen increases and then you ovulate, the follicle ruptures, and it drops a little bit. Some people have spotting in the middle of the cycle, some people have migraines. So it's usually because of the ratio of estrogen and progesterone. And so that would be another time. Nick Aluna, I have not seen a single question for you. So if you just want to list it again, that's fine, but I haven't seen anything on my end. So if you could just repeat it, I'd be happy to answer it. But I haven't skipped any questions. I'm going in the order they're coming in. Kelly Hoffman, so it is estrogen related, as I thought. Yeah, I think it's probably the change in estrogen. Oh, Kelly, that's interesting, because a lot of times people will get really angry with me that I'm not answering their questions. So maybe that is why that I'm not seeing them on my end. Maybe there's a word that's not allowed or something like that. That's true. But yeah, I haven't seen anything. So please rewrite your question. I'm happy to answer it. So as I mentioned, for those of you that are new here, we usually on Tuesdays will go live for about half an hour. You know, it's whether or not I remember to charge my phone and what else I have going on. Some of the Tuesdays I am involved in teaching for the Integrative Psychiatry Institute, their Precision Medicine Fellowship. Oh, Kelly, you asked your question earlier and didn't go through, so you reworded it. That's interesting. I never knew that. That's why. Thank you for explaining that, because I could never understand why maybe I wasn't seeing questions. Okay, I take progesterone to stop my period. So it is an estrogen level of 99 okay to start estrogen? Well, that's an interesting question. So if you're trying to stop something from happening, that's an artificial state. So that's not something I would do in my practice, because we're trying to mimic natural physiology, what your body naturally does. So I'm not usually trying to stop a period for contraception or something like that. So it would depend on a lot of sources. If you're trying to stop your period and then you're adding estrogen, it's kind of repetitive and kind of like, why not just not stop the period? And then you might produce some estrogen. That could be.
Here's what, let them know that they need to click on the live chat, and then it will open up and they can see the
resources. Oh, okay. For those of you that are on YouTube, I guess you need to click on the live chat. So it looks like Purpose-Filled Life. Love your name. How can you differentiate perimenopause symptoms compared to just breastfeeding causing perimenopause symptoms because of estrogen drop? That's a great question. Postpartum and breastfeeding is a time where you're exhausted, so your cortisol is affected, your estrogen is low, and your progesterone is low, because likely you're not ovulating. So it is definitely difficult to tell. We do test hormones during that period, depending on how far along you are into the postpartum period. So It really depends on what the symptoms are. We would still do blood work for someone who's postpartum, unless you're like 2 weeks postpartum, but we would still definitely do it within that window. And that can help us decide and taking a thorough history. Okay, Marta, I don't know if I missed your question last time. How do I lower my cortisol? Any supplements or lifestyle changes? I might have. So thank you for posting it again. Okay, cortisol is a funny one, guys. So lowering cortisol, supplements that generally lower it is phosphatidylserine. Okay, things that relax you are things that like L-theanine that turns the mind off, and there are certain supplements that are called adaptogens that can do either. Rhodiola, ashwagandha, they can be used for either low or high cortisol. Lifestyle changes are huge. Eliminating added sugar, processed food, finding what you love. Do you love walking outside? Do you love watching Netflix? Do you love knitting? You got to find what calms you. Sitting with a cat, sitting with a dog. I'm a dog person, but my daughter has 2 cats and that seems to calm her. So whatever for you helps calm you. Progesterone is used for my adenomyosis. It naturally stopped. It didn't mean, oh, got it. So you got a really complicated situation, Purple Heart. So yeah, it's a really hard situation because you're doing one thing to stop your pain from adenomyosis. Again, with our patients with endometriosis and adenomyosis, NAC and acetylcysteine is really great, and resveratrol. So both of those things can be helpful for pain. Canadian Gaijin, what are most women in perimenopause doing for birth control? That's a great question too. My favorite form of birth control is vasectomy. And especially if you're done with your family, tubal ligation, vasectomy, permanent birth control that's non-hormonal is good. But you're right, that is a question. A lot of my patients are doing an IUD, which is hormonal. So it's not non-hormonal, it is hormonal. So they're doing a progestin IUD, or they're going back to good old-fashioned barrier method, diaphragm, and condoms. Okay, purpose-filled life, breastfeeding 18 months. So certainly it is not too soon for you to get your hormones checked because it's been over a year. So I've seen patients 8 months, 9 months postpartum breastfeeding for their hormones. Okay, so Purple Heart, yeah, the estrogen, it's a complicated thing. So I can't really answer your question because you have a complicated situation, and we would really weed through that in the office. But I would really encourage you to find a hormone provider to work with you. LM, is 68 too late to start BHRT? Thank you for asking that question. I get asked that a lot often. The Menopause Society says that between the ages of 50 and 60, or 10 years since your last period, is a safe window that has decreased risk to start hormone therapy. It's not that you can never start it at 68. It's that you have to see what your cardiometabolic risk is. So if you had a period at 58, if that's when you had menopause, it might not be too late. But if you had menopause at the average age of 52, you're a little outside the safety window. Not that you can't start it, but you need a full cardiometabolic workup, hormone workup, and you need somebody who can really walk you through that. I love nothing this stage of life. Aw, Kelly, I know everything hurts at 47. I can tell you that I think I felt best at 43. I mean, I'm 56 now. I'm feeling a little bit better, but I think I'm still trying to get a handle on the stress issue. So it does get better. And most of my patients feel much better once the up and down of perimenopause stops. Nicoluna, the girls are sore from estradiol 0.0375. Is that normal? So Nicoluna, thanks for repeating your question. That breast tenderness is a sign that for you, it could be too high of an estrogen dose. So you can do a couple things. See if your doctor is going to check your levels. If not, try to wear the patch longer. We recommend you change the patch twice a week, Monday, Thursday, Tuesday, Friday, Wednesday, Saturday. But some of my patients will wear it 4 or 5 days. That means you're not always changing the patch on the same day of the week, and it's harder to remember, but it might be a little bit easier for you. Okay. Let's see. Someone else said my volume is low. Okay, Amanda. Yeah, Purple Heart. Yeah, so it's hard to really get medical advice on social media, especially when you have such a complicated situation of yourself. So sorry I couldn't give you more help. Like I mentioned, try the N-acetylcysteine or try the resveratrol. And there are also other people in my office besides myself that I supervise that have a lower price for their office visits. So that could be an option too. Amanda, why did I get diagnosed with premature ovarian deficiency if this is the new normal age 30 to 35? So that diagnosis is complicated because I'm interested in how people are making that diagnosis without 1 year without a period. Are they just going by a low AMH or not? I'm not sure. Okay, purposeful life. What do you think about taking creatine and fasting for weight loss? I've heard different things on that. So I do think creatine is helpful for women. I haven't dug deep into, and I can't quote all the literature off the top of my head, but I do take it myself. So I think that could be helpful. I think fasting for you want to make sure you're hydrating since you're still nursing, but definitely a couple, maybe 2 to 3 days a week, maybe not every day. You want to have what's called metabolic flexibility. So if you do the same thing every day, your body's going to adapt. I am a fan of that, though, for both of those. Okay. Amanda, I am her. Okay. Canadian, do you think an IUD would be bad with the tilted cervix? And my gyno has had a hard time doing a PAP. Yes, if they have a hard time doing a PAP smear and your cervix is tilted, it could be difficult to insert an IUD and it can be painful. So that could be a problem. So talk to your husband about maybe getting a vasectomy or your partner, or think about maybe a diaphragm or condoms. Oh, I am HRT, Amanda. You're saying you are taking HRT, low FSH hormones, low estrogen specifically. Yeah. That's how they diagnosed you. Well, are you still having a monthly cycle? Because that could differ, even if your estrogen's low. So, but that's something that, is again, Amanda, looks like you're having a monthly cycle. So yeah, it's a complicated situation as well. Purple Heart, is DHEA a helpful thing to measure? Yes, we always measure DHEA unconjugated and DHEAS both. Those don't have to be at a certain time of your cycle. They can be any day, but they should be in the morning. Christine Lynch, testosterone pre-2, testosterone total 25. Should I be on a testosterone gel? Well, I would also, Christine, look at your sex hormone binding globulin and your dihydrotestosterone before making that. You have it on the low end. Testosterone is indicated for postmenopausal low libido. So it would depend on what your symptoms are. We don't just test the test results. We look at the patient and the symptoms to decide on the treatment. Canadian Jill, I need something to stop my period because of my severe PMDD and twice monthly periods. Yes, so it's a chance that IUD could be helpful. Your doctor may be able to get you put it in under anesthesia potentially, or give you something called Cytotec to soften your cervix before. So there's a lot of options for you. Talk KHA, you look like Nikki Haley. Do you know who Nikki Haley is? I don't know who that is. What level of testosterone is optimal to help osteoporosis? Well, we don't look at a specific testosterone. For osteoporosis, we look at a urine CTX, which measures bone breakdown. We look at an alk-phos bone specific. We look at a bone density, and we also look at a PN1P-NP, which is a pro-collagen N-telepeptide that's measuring bone building. So we don't just look at testosterone. So that's one of the things we do. So Rico Kuliakana, we just dropped a free guide to testing. So check out the link in our bio here. Check it out, and you can see that we have that free resource for you all about testing. What's that scraping noise? I don't know. Do you hear a scraping noise? Yes. Who do you monitor for osteoporosis? That's a great question. So postmenopausal women, I do. Some insurances don't pay until after 54. Medicare won't pay till after 65. And again, that depends. Premature menopause, hypothyroid, low body weight, all of those things are risk factors for osteoporosis, poor absorption issues, celiac disease. Okay, Amanda, very difficult. MIDI Health is who I started working with. Yeah, actually. Oh, you want to understand the diagnosis. Okay. Thank you for reminding me, Amanda. There are a lot of telemedicine companies that have popped up so people can get health. I think MIDI, Alloy. I don't have any experience with any of them because I'm not familiar. I don't work for them. So those are all ways that you can get help. Okay, let's see. I think I got all the questions at YouTube. I'm going to take a couple more questions and then wrap this up. Alma Campirano, what does high SHBG mean? Okay, so SHBG, sex hormone binding globulin, is a indirect measurement of your estrogen. It's going to be high if you have high estrogen. It's the protein that carries your hormones in your blood. It's going to be low if you have metabolic syndrome, like high insulin, or if you have a testosterone issue. So Alma, if you've previously been on a birth control pill, it could elevate that. Or if you're currently on a birth control pill, or if you have high estrogen, those are all reasons that your SHBG would be high. You got osteoporosis way before 50. Yes. And I just had a patient who was premature menopause, and I asked her to ask her PCP for a bone density. She said they won't cover it because of her age. And I'm like, she has premature menopause. She's hypothyroid. She has celiac disease. Did they not put those diagnoses? So you're right. Kelly, you got BP fluctuations. Yes. Okay. Amanda, check out, if you haven't seen, we have just launched, and anyone else, a free course with more information. If you aren't subscribed to my YouTube channel, I feel like it's a little bit easier to search for a specific topic there. But we do have a lot of other information, free things there. Follow me on Instagram. Sign up for our free newsletter. It comes out every Tuesday, most Tuesdays, unless I'm traveling. And tune in Tuesdays, 7 p.m. Eastern Time. Again, if I haven't had any other teaching issues. CG888, what if SHBG is high but other hormones are normal? So again, it's hard to say when hormones are normal, because when in your cycle were they tested? What hormone labs are they actually looking at? But anyway, thanks for all of you that tuned in. I appreciate it. And if there's something you want to hear about it, comment on this on YouTube. If there's something you want to see in our newsletter, and check out our new free testing guide and our free newsletter and our free hormone course. So have a great weekend and enjoy the sun.